Well, welcome to another episode of Coffee Talk with Encore. Today, the focus of our Coffee Talk discussion is on providing the right therapy at the right time, while at the same time maintaining a person-centered approach to therapy services. We have a couple of different perspectives to consider, one being from the patient's perspective. So what do our patients need and want from therapy in order to achieve their goals? And the second thing to consider is from the therapist's perspective. Which discipline or disciplines are needed at various points throughout the patient's therapy stay, and which disciplines would provide the most value to the patient based on their identified impairments, the appropriate frequency, length of stay, and the patient's discharge plans. So there's certainly a lot of critical thinking to do in order to determine the right therapy and the right time while maintaining patient-centered therapy throughout the entire course of the patient's stay.
Definitely. So we've seen this shift from PPS to PDPM, which is really focused more on the quality of our services rather than the minutes that we are providing. So there's gone are the days of providing 720 minutes, right off the bat, PTOT speech on day one, just to cram all those minutes in. So, CMS has kind of led the charge, of course, to really kind of make us as clinicians kind of take a step back and focus on the quality of our services. So choosing the right discipline starts at admission. So are both PT and OT needed right off the bat? Speech therapy. So what are your patient's goals and what do they want to work on when they come into our facilities through our doors? So there is no hard line that states that all three disciplines, or even two, PT, OT, are needed day one or day two of our patient's admissions. So Kathy, I think that you have given me this example in previous conversations, but I really think that, this example rings true in a lot of cases. So if your patient is really working on the basics of like bed mobility before they can even get up to go to the commode, maybe PT is starting off the plan of care with addressing the bed mobility, those sit to stands. And then maybe a week or two later, OT is coming in and then working on the toileting aspects and the dressing and all of those other components. So really just looking at your patient as an individual and deciding what that patient needs and really managing their case well. So again, really taking a look at the treatment that we're providing and determining if it is medically necessary along the way.
I think medical necessity is huge. And a lot of times when I have conversations with therapists, it's about the difference between medically necessary and medically beneficial, right? So we all know that we would benefit from going to the gym. I, certainly wish I could go to the gym more often, but it's not necessarily medically necessary for me to go to the gym and do leg exercises. And when we think about our patients, we have to figure out which are those activities that are medically necessary for them. Would we all benefit from some leg strengthening or some arm strengthening? Yeah, probably. But is it medically necessary to get that patient home? I know when I started working in nursing homes, we used to laugh about what I called the lower extremity 4, right? So I would walk into the gym and every single patient would be doing the same 4 seated leg exercises. We all know them: the marches, the long arc quads, the ankle pumps, and that knee in and out hip AB adduction, right? But how many patients was that actually necessary for? And so as therapists, we really need to challenge ourselves now to think, what's the most important thing that I can do for my patient? And what's the most necessary activity, a necessary function that I can give my patient to get them to that next level? And sometimes it may mean that I have to say, you know what, I'm not the discipline that's needed right now. And that's really hard for us as therapists because we always want to give that to our patient. We always want to think that we're the most important, but sometimes we need to back off and we need to say, you know what, my patient would be better served to spend more time with another discipline first.
So with that, Becky, we have to then determine who is the discipline that needs to be involved, right? So how do we do that? With that, we have to use our critical thinking. So we have to figure out what are the current deficits, right? Do they have strength deficits, coordination, balance, what's going on there? And then how does that tie into the current functional levels? So how are those deficits affecting function? Once we do that, we can really dig through the task, performing that task analysis, and really figure out the root cause to determine which discipline should be involved, right? So for someone that we have who is pretty high level, but struggles with, maybe toilet transfers or something like that. If the reason why they can't do the toilet transfer is because of a standing balance issue, and if that balance was improved, they would be able to toilet, then do they really need OT? Maybe not, because the PT is probably going to be working on standing balance. And with that increase in standing balance, that improvement in that function will naturally increase the independence of the toilet transfer. And then when it comes to low-level patients, as Becky mentioned earlier, sometimes it is best to just start with one discipline and, kind of progress forward as they make more improvements with therapy.
So a lot of times what we see, especially now with healthcare changing, is patients are coming in from the hospital and they're still really very critically ill. We're seeing patients get discharged directly from the ICU over to the nursing home, or maybe they've been out on the regular floor for a day or two, but they're just at that still critically ill point in time. Or maybe they're just very severely impacted by what's been going on. And so one of the things that's really new for us is to start thinking about maybe that patient really would benefit from speech therapy first. Maybe they're not even ready for PT and OT to come in. And I know Ashley's excited, right? But we have to take that time and think about it, because a lot of times, if that patient can't communicate with us and they can't participate in our treatment session, then we need to back off and we might need to wait a little bit and let that speech therapist jump in.
And here's where I jump in. So as our patients are coming to us a little bit more medically complex and compromised, it is really important to kind of think about who can benefit the patient the most, the first. So if your patient is really medically compromised and they're not going to be jumping out of bed and walking across the room with PT, what can we do for this patient now? So really taking into consideration communication. Can they communicate basic pain? So if they have, multiple tubes, if they have a trach, if they have a peg, or even patients that don't have that many attachments, but maybe they just really need to be able to communicate that they're experiencing excruciating pain, and maybe medically they're just not even appropriate or, a candidate for PT and OT to get them moving with those body functions. So really making sure that we are addressing, I always try to talk about speech therapy interventions in like a hierarchy. So it's kind of starting at the bottom. What does your patient need right now? They need to communicate. And chances are, if they're pretty medically compromised, maybe they have some swallowing impairments as well. So even if it's just, setting up an oral care program, if they're NPO, making sure that we're providing consistent stimulation to make sure that we are not losing swallow function, so we can return them to PO intake. So again, focus on those small hierarchical areas of communication. If your patients are lower level, for communication, expressing that pain is really important. And then we can definitely progress with PT and OT once we have a start on these really vital areas. So your patient can communicate to the physical therapist and the OT that they are experiencing pain and they can't move their body that way yet.
Mm-hmm. Huge and extremely important, and all very good points. And, and as we're hearing from, each of us really contributing to all of this discussion today, we can really see that clinicians have a very important role in determining the best route to go with regard to deciding which disciplines should intervene, and then when each discipline should not only begin their treatment sessions, but then also to discontinue sessions, because it might be that a therapist doesn't need to continue their discipline of therapy throughout the course of the entire stay. Maybe it's just a handful of visits that are needed at that particular time for that individual. But at the end of the day, we just really need to make sure that what we're doing is providing that patient-centered care approach to each and every one of our patients, that beginning from the moment they, enter the facility to the time that they discontinue services and hopefully get to return home. Well, we do want to thank everyone for joining us today and hearing all about the concept of providing the right therapy at the right time. We really look forward to having you tune in again to our next episode of Coffee Talk with Encore.